Welcome to I'm Pregnant, Now What? So in this video, we're going to talk about calculating your due date, scheduling your first appointment, finding the right OB provider. We're also going to talk a little bit about prenatal vitamins and what to expect in the early weeks of pregnancy. So calculating your due date. Here's the old way that we used to calculate due dates. So we would count 3 months back from the first day of your last menstrual period and then add 7 days. Nowadays, most of the time, people are going to use some form of technology. So you can use an app. This is the Perfect OB Wheel. That's the app that I use. It's a free app. It's accurate. There are a lot of wheels out there, and you have to be careful because not all wheels are accurate. This is an accurate one. It's used by a lot of OBGYNs. You can also use a website like perinatology.com to calculate your due date. If you don't necessarily need an app on your phone because you don't have to do it all the time. I have it on my phone because I calculate people's due dates all the time. All right, so let's talk about scheduling your first appointment. So the general rule is we usually see people between 8 and 10 weeks. And we see them during that time because if we see people earlier and do ultrasounds earlier, we're more likely to not be able to tell them if they have a viable pregnancy or not. When we do ultrasounds too early, sometimes we cannot tell if the pregnancy is in the uterus, or even if we think it's in the uterus, we don't necessarily see an embryo with a heartbeat. So that's where the 8 to 10 weeks usually, comes from. It used to really be more to the side of 8 weeks. And I will say after COVID and after the pandemic, people started seeing more patients at 10 weeks, and that just kind of stuck. I think that 10 weeks is a long time to wait for an appointment. I had to wait 10 weeks with Hudson, which was longer than I'd waited with any of my other kids. And it was difficult. It wasn't easy. So please understand that there are also exceptions to this general rule. And one of the exceptions can just be that you're really worried and stressed. And the fact that you haven't had an ultrasound, you haven't had any evaluation is really weighing on your mental load. That to me is enough of a reason. And I would hope that for most OB providers, if they have somebody who's really anxious, would agree to see them before this, usual time. So some exceptions to this 8 to 10 week rule is, if you have any pain, if you have bleeding, if you've got nausea, and it's not responding to lifestyle modifications. We're going to talk more about nausea and vomiting in pregnancy, in a few lessons. So I've got you there. And also, if you have medical problems like thyroid conditions, if you have diabetes, if you have hypertension, if you have any medical problems, we need to make sure if you haven't recently had a preconception appointment where your numbers were evaluated and we made sure that your health was optimized, we need to make sure that whatever's happening with you from your other medical conditions is optimized and isn't going to impact embryology, your embryogenesis, which is the formation of the embryo, and the health of your pregnancy. Now, understand that if you were looking to get an appointment before the 8 to 10 week mark, that sometimes this requires advocating for yourself. And it's frustrating, but the reality is that a lot of times the schedulers, the people who answer the phone to schedule at doctor's offices, at midwife offices, they're rarely medical professionals. And their job is to get the right people in the right slots. And when, a lot of offices have a doctor or two that maybe is a little bit hard on the employees and they're worried about getting in trouble. This happens all the time. They don't want to schedule something and get in trouble from their bosses who, oftentimes are the doctors. So they will, give you pushback if you're trying to get an appointment at a time they don't usually do it. But understand they're not medical, and you can always say, I really do want to be seen. Can you please ask Dr. So-and-so or this midwife and make sure that, they are also saying no, that I can't be seen early. Most of the time that's enough. Okay, so let's talk a little bit about choosing your provider. So the things that you want to take into consideration when you're choosing an OBGYN for pregnancy specifically is where does that provider deliver babies? Where do they help people give birth? And where do they have hospital privileges? Most providers will have one place, maybe two places that they deliver babies. And so you want to make sure, even if you like the person, if they are delivering at a hospital that is totally, an hour away across town, or that you don't like, you want to know that before you start going to them and then realizing, oh, they deliver at a place I don't want to have a baby. So you think about where they have hospital privileges. You also want to think about their practice, the practice style, and you can think of their practice style in terms of how big, how many doctors are in it. Do they work with midwives? Do they work with PAs? And we'll touch on that in a sec. And then also their personality and their philosophy. Most doctors' offices have a culture, okay? And oftentimes the physicians, the midwives in the group, they kind of set the culture, but the other people who work in the office set culture as well. And so if you have an office that's difficult to get a hold of, where people, the receptionist and the medical assistant and everybody is not giving you warm, caring vibes, that's important, okay? You're going to be there a lot when you're pregnant, and pregnancy is hard, so you want to be at an office where you feel like you're really being taken care of. So this is kind of a step-by-step process for choosing a hospital or a birth center, okay? So if you are in the United States, then oftentimes the first thing you have to consider is insurance, okay? You want to make sure that the hospital where you want to deliver is in network for your insurance, and that the providers who work there are in network for your insurance as well. So that's usually the first step to kind of narrowing down the list, is where can I go? And then you can ask around, you can get recommendations from friends and from family. And then once you've kind of narrowed down your list to a few, you can start doing a little bit of research. I don't want you to do research on, like, if you live in a big city, there are so many hospitals. If you're in a smaller city, there's less, but if you're in a big city, there's a lot of hospitals, and I don't want you to have to do research on all of them. So whittle down the list before you do research. The things that you might want to look into are, one is the NICU, okay? That's NICU is short for, is an acronym for Neonatal Intensive Care Unit. There's different levels. We'll go into that. You may want to ask them what kind of lactation support, what their ratio of postpartum beds to lactation consultants is. So some places will have, a lot of lactation support, and they have ongoing support groups, and they may even have, a gift store in the hospital that has, pumping bras and lactation supplements and all of that. So you just ask about their lactation support. And then if you're somebody who's considering a vaginal birth after cesarean, you'll want to know, does that hospital offer vaginal birth after cesarean? Because the hospital has to meet certain criteria in order to offer VBACs. So let's talk just really briefly about NICU levels. So I'm not going to go through all of this. You can download the slides where you're watching the video to if you want to go through the nitty gritty. But basically, not every hospital is able to take care of all babies. So if you are at a birth center or a small community hospital, there may just be what we call a well newborn nursery. And they just have providers who can take care of term healthy babies. And this provider may just be the midwife. If you're at a birth center, it may just be the midwife who delivered you has some certifications in basic infant care. They can't take care of sick babies or premature babies who need support. So that's a level 1 NICU. Level 2, they have a special care nursery, so they can typically take care of some preterm babies, but not medically complicated babies at all. A level 3 NICU, that is where you have, they have an actual NICU. So level 2 is called a special care nursery. Level 3 is an actual NICU. So this is where we can, they can take care of preterm babies. They can take care of babies who are critically ill. They can take care of babies who need surgery. And then the highest level is a level 4, and that's a regional NICU. Not every area is going to have a level 4, but this is basically this is your children's hospitals, okay? Like Children's Hospital Los Angeles, Children's Hospital Chicago, right? These are, and some Some of them are standalone. Hospitals have a level 4 regional NICU, and some of them are also in a hospital that has a labor and delivery unit. So it just depends. So that's, if you know, especially if you've had a preterm baby or you have a history of preeclampsia or a history of pregnancy complications, you're going to want to go somewhere that has an actual NICU, so a level 3 at the minimum. Okay, so then I promise we talk a little bit more about practice styles. So there's a lot of different styles to practices. Kind of the old way of doing it is solo providers, like an OB who just had an office. They hung up a shingle, small town. They deliver all their own patients. They're on call 24 hours a day, 7 days a week. That's how things used to be. It's pretty rare these days to find a solo provider. You can imagine being on call 24 hours a day, 7 days a week is a lot. But they do still exist, particularly in small towns. You'll find small groups where it's a group of, 3 OB-GYNs or 2 OB-GYNs and a midwife. And so you have one primary provider, and you'll probably see the other 2 maybe once or twice in your pregnancy, and they share the deliveries. So they, one of them will be on call. So you have like a 25 or a 33% chance of having your provider deliver your baby. So that's a small group. And then what's becoming more and more common is large group practices where you have 5, 6, 10, 20 doctors, and it gets, to really large practices. And that's pretty common because then you have people, the reason why those practices are becoming more common is because obstetrics is something that happens a lot at night. A lot of babies deliver at night. And so it's difficult to do night shifts and do 24-hour shifts. So when you have a bigger group, then each individual has less of a burden of being up in the middle of the night or for 24 hours. And so, a lot of OB-GYNs are moms as well, and they have families. And so, as you can imagine, we are not men who have a stay-at-home partner doing all the things for us at home like it was back in the good old boy days of, white white male practitioners who had people at home taking care of everything. So the whole, the field of obstetrics has changed drastically, even in the last 30 years. So we're seeing a lot more large groups as the field has become much more populated by women who don't want to be away from their families and want to be able to sleep and have appropriate boundaries with work. So you'll see a lot more large groups. I think that large groups can provide really, really great care because they're less burnt out than a lot of small groups and solo providers. Though sometimes it can feel a little impersonal. So that is just to say, I think there's a lot of benefits for large groups, but there are some downsides too. And some groups work with OBs and midwives and physician's assistants and nurse practitioners. And these are all ways to kind of try to share the workload. And so no one person is really burnt out and overburdened with patients. The healthcare system, in the United States and in many countries is really overburdened. And so, finding a practice style that you feel really comfortable at is really important, but there's pluses and minuses to all of these different styles. All right, so let's talk a bit about choosing your prenatal vitamin, because if you are not already taking a prenatal vitamin, it's really important to start. So, you know what? Actually, we're going to first, these slides are a little bit out of order. Let's talk about, let's talk about researching your provider before we get to choosing your prenatal vitamin. So researching your provider, one, you're going to want to talk to family and friends. If you have any friends or family who are nurses who work in labor and delivery and postpartum, they're great resources. You can check for board certification for American physicians at abog.org. That's the American Board of Obstetrics and Gynecology. You can check for their medical license. So if they have, if there have been any reports to the state about this doctor, it will show up on their state medical license. So you just Google your state and medical license. Almost all countries, Canada, European countries, Israel, they do have a special medical license beyond just having a medical degree. So a medical degree is one thing. If you have an MD, that doesn't necessarily mean you can practice medicine. You also typically need a medical license. So you can check their medical license, and you also can look at where they went to medical school and where they went to residency. This is something we call their pedigree. Did they go to Harvard Medical School and Harvard residency? That's a good sign that that's somebody, those are great programs, right? And not that you're going to know all of the great OBGYN programs, because some of them are not hospital affiliated or not university affiliated, and they're phenomenal. But it's just a piece that you can take into consideration. And you can always ask me about, your provider's credentials and, if that's a good medical school or if that's a good residency program. I would not make my whole decision based on that. I think that's a piece of the puzzle. Okay, now let's talk about choosing your prenatal vitamin. Okay, so the most important thing in your prenatal vitamin is the folate, okay? Especially in these very early weeks of pregnancy. So the recommendation from the CDC, from ACOG, is for everybody who does not have a higher risk of neural tube defects. So you don't have a history of a neural tube defect. You're not on any special medications that impair folate metabolism, such as seizure medications. That you take 400 micrograms daily of folic acid. Now, there is a little bit of a debate going on a little bit. It's a debate for sure between some providers and nutritionists about the type of folate that's best to be supplemented with. And we have a video, a discussion between me and a prenatal nutritionist going over, kind of what the debate is between methylfolate and folic acid. So you can do a deeper dive into that if you'd like. The long story short, methylfolate is considered like the active form of folate. This is the form of folate that your body actually uses. Folic acid, it has to be processed by your body before it's in its active form. Folic acid is around because it's a shelf-stable form of folate, which was an issue. Getting folate in a shelf-stable form was an issue when we first started supplementing with folic acid, but now companies have come out and said, we're actually able to get shelf-stable methylfolate, which is the active form. Issue is that all of the randomized controlled trials that were done to see if folic acid works to reduce the rate of neural tube defects, spina bifida is an example of a neural tube defect. All of that was done with folic acid specifically. And so the reason why the CDC and ACOG haven't changed their recommendations, even though there's a lot of people who are saying, hey, actually methylfolate is a better way to supplement for folate. This is a better form. It's more easily absorbed, etc. The reason why they haven't changed over those recommendations, even though there is very promising data about methylfolate, is because we don't have the randomized controlled trials that show that this form of folate reduces the risk of neural tube defects. I will tell you, I think that it probably does. But when push came to shove for me, I felt most comfortable sleeping at night knowing that I was taking folic acid and I was taking the form that has been shown to reduce the risk of neural tube defects. I think that if you've been taking methylfolate, I don't necessarily think that you made a wrong decision. I personally feel most comfortable taking the form that has been studied, but there are OBGYNs, there are maternal fetal medicine specialists, there are nutritionists who take the methylfolate version, and they're very smart people. So let's take the pressure off. If you want to do a deep dive and learn more about that debate, go watch that nutrition in pregnancy interview that I did with the prenatal nutritionist. Okay. Now, other things that you can look for in a prenatal vitamin. I will say there's no such thing as a perfect prenatal. I have not found a prenatal vitamin that hits everything that I want. But, choline is important for development. A lot of prenatal vitamins don't have choline in it, but it's in eggs. I eat a ton of eggs. That's just like something that my family eats a lot of. So, and even in pregnancy, a lot of people get adverse to eggs. I was fortunate that I didn't. So I was able to eat eggs. So I could have a prenatal vitamin that maybe didn't have choline because I know I was getting it a lot in my diet. DHA from algae or fish is a good idea. Vitamin D3. Vitamin D3 is the active form of vitamin D, so that's the form that you know is ideal to take. Selenium is another thing that's important for fetal development. So you can look for a prenatal that has selenium. If it doesn't have selenium, right? If you're like, I really like this prenatal, has all the things that I want, you know, I look for kosher prenatal vitamins. That might not matter to you, right? So you find a prenatal that you're like, oh, this has all the things that I'm interested in, I want it to have, but it doesn't have selenium. Then you just look for food sources of selenium, and you know, Brazil nuts, for example, are a good source of selenium. So if it doesn't have something that you want, you can always try to, you know, get that from food. Truthfully, food is the better place to get our nutrients, you know, especially the micronutrients. Because we absorb nutrients better through food than we do through supplements and pills. And you can also look for vitamin B12, particularly if you're, you know, a vegetarian and you don't eat a lot of meat. Vitamin B12 is important. Okay, now let's talk a little bit about iron. So before you're pregnant and in the early weeks of pregnancy, you don't necessarily need iron right away. You will eventually, especially, you know, when we get into the second trimester, if you're able to tolerate an iron supplement, you're going to want to take an iron supplement. But iron does cause a lot of constipation, and so it can make, you know, constipation is common in early pregnancy, as is actually diarrhea. And iron can make kind of, for some people, can make nausea, and you know, the constipation and the nausea all going together, it can make things worse. So a lot of people find that they're better able to tolerate a prenatal vitamin that doesn't have iron. You will want to try to eat foods that are rich in iron, and especially when we get into the second trimester, your body will require more iron. But initially, if you're not iron deficient, you might not need an actual iron supplement in those early weeks. Okay. So here are some prenatal vitamins that I like. This Rainbow Light. The downside is that you have to take a separate DHA, which, you know, if you're feeling nauseous and whatever, that might not be ideal. But I like this one. In terms of gummy vitamins, which are oftentimes better tolerated by people in the early weeks of pregnancy, this one is the most complete gummy vitamin that I found. By the way, none of this is sponsored or anything. These are just, you know, personal preferences. This is a really good prenatal gummy. Does not have iron. The iron can't really come in gummy form. So when you have gummies, most of them, I don't think I've ever seen a gummy that has iron in it. And then remember, the most important thing is the folic acid, is the folate. And so if you cannot tolerate, you know, a full prenatal big, you know, horse pill, you can't tolerate a gummy, just at least make sure that you're taking care of the folic acid component. All right, let's talk about what you can expect in the early weeks. So in terms of symptoms, it's very, very common for early pregnancy symptoms to kind of wax and wane, to come and go. So you may feel terrible first thing in the morning, and then you feel a little bit better, and then you feel terrible again. Or you could feel really great a lot of the time and then just have a day where you don't feel great. So it's very common that these symptoms wax and wane, and understand that not everybody feels awful. Not everybody has nausea. And we'll talk more about some of the symptoms, early pregnancy symptoms, in a bit. But there's a huge spectrum. Some people feel great in early pregnancy, and some people are truly, truly miserable. Most symptoms are going to start before or around 6 weeks. So some people feel freaking fantastic at 5 weeks, and then bam, that 6 week mark hits, and they're feeling not so great. Common symptoms are nausea, fatigue, lightheadedness, breast tenderness, all super common early pregnancy symptoms. And what we see is in the early weeks of pregnancy, that pregnancy hormone level is increasing. It's getting, you know, it's doubling every 2 days or so. There's a range there, but it's increasing a lot. And then around the 10-week mark, we start to see a plateau in the pregnancy hormone level. And so a lot of people will start, they might not necessarily feel better, but they'll feel like things aren't getting worse anymore. And some people do improve around that 10-week mark. And that's a really common time for someone to reach out to me and be like, help, all of a sudden my pregnancy symptoms are so much better and I'm freaking out. Doesn't necessarily mean that something's wrong, especially if it's happening around 10 weeks. That's pretty common. All right, now let's talk about what to expect from the emotions in the early weeks. So if this is, your first time being pregnant, or you've been pregnant before and you've had a loss, I just, I want you to understand that mixed emotions are really, really common in pregnancy. We, as a society, tend to act like the only emotion that we really want pregnant people to experience or feel is excitement. Everybody, when you tell someone you're pregnant, they're like, oh, are you excited? That is the common saying. Excitement is not a universal emotion in pregnancy. Some people can feel excited at periods, but the idea that you're going to be excited all the time through your entire pregnancy, that would be exhausting, right? Excitement is not the type of emotion that people feel always. So you may feel excitement, but you may feel a lot of other emotions too. And you can actually experience a lot of contradictory emotions when you find out that you're pregnant. You can be excited and you can also feel some regret. I have felt that, especially if you're feeling really bad. It's difficult to feel grateful and happy and excited and just blissed out when you're also feeling like crap. So you can feel two emotions that seem like they don't go together all the time in pregnancy. And I think for a lot of people, the reproductive journey in pregnancy is the first time that they've really felt two strong emotions at the same time, that they've, I think that we feel that way our entire lives. But when we have this, you are supposed to be excited and happy, and we don't feel that way, we feel maybe some excitement, but we also feel some fear and some worries. It all of a sudden becomes really obvious to us. Oh, I'm feeling, I should be feeling this, but I'm also feeling this. It becomes really obvious to us that we have these contradictory emotions. And for some people, this is the first time they're really recognizing that they're holding these contradictory emotions at the same time. So it is a learning process. And if you've gotten comfortable holding opposing emotions previously in your life, amazing. Good for you. You're ahead of the curve. I will say a lot of people, this is our first introduction to experiencing emotions that are so contradictory. But contradictory emotions, that is like, if you're a parent, you know this, that is one of the core parts of parenting, is both loving your children so freaking much and also being like, is it bedtime yet? It's like, that is parenting. So this holding these contradictory emotions or contradictory thoughts and feelings is not something that goes away in pregnancy. This is something that carries us through. So getting comfortable with the fact that it's okay that you may feel some of the some negative emotions, but also feeling some positive emotions. This is all okay. This is part of parenting. This is why you're here. We're going to help you hold space for these contradictory emotions and let you know that it's okay to feel this way. A fear and regret are far more common experiences than most people acknowledge, okay? When I got pregnant with all three of my kids, I had a degree of regret. I wanted each one of those pregnancies. I was trying to conceive each one of those pregnancies, and I was truly grateful and happy to be pregnant each time, still feeling some regret. Because for me, my early pregnancies are really, really, really miserable. So when you're feeling terrible for days, weeks, months, it's really hard not to feel regret. And so I just want to remove any guilt or shame you're feeling about feeling any negative emotions, any fear, any worries. It is, you are human, and you know, giving yourself permission to be human and have these different emotions is a huge lesson. It is a big lesson, and it's a big win when you can forgive your emotions, okay your emotions, and move through that. So you're doing incredible work. All right. Congratulations on your pregnancy. I will see you in the next video when you're ready.